Okay, welcome everybody. The first thing we're just going to do is I do want to make sure that everyone is able to hear me. So I'm just going to try and get my colleague Robin, who is also here, to just chat a little bit, like put a little text in the chat function so that hopefully if anyone can't hear us, they would be able to see the chat. Welcome everyone. Thank you so much for your time, and we definitely appreciate all of you being here. My name is Laura. I work for Pallium Canada. I am part of the support desk team here. And basically, the idea of this webinar is to really take the time to go through a few of the elements that are integral to hosting a LEAP course. Before we start, I did want to inform you that we are going to be recording this webinar. So just that. And then we were just going to start with a little bit of the agenda with a bit of a welcome. We wanted to go around and give everyone a bit of an opportunity to say hello and sort of introduce themselves, tell us a little bit about your role as well as where you're from, just a little bit of a hi. And then from there, there'll be an introduction from, I believe, Ashley and Sharon. We're going to do a bit of an introduction. And then I will just go through the rest of the agenda sort of as our morning goes on. I'm hoping to get this webinar done in about an hour and a half, so hopefully we'll be able to stick to that. But if not, we did allot a little bit more time. So if you have lots and lots of questions for me, I am definitely looking forward to hearing from you. So please don't hesitate to ask us questions.
Great,
okay.
Thank you. Would you like me to start just saying hello?
Yes, that would be perfect.
So good morning, everyone from Halifax. So I'm in Halifax. My name is Sharon Costi. I work with the Nova Scotia Health Authority in the palliative care integration portfolio. And I am the new policy and planning advisor. So I just started in September, so a couple of months in, and I am primarily responsible for LEAP and the interface between the Nova Scotia Health Authority and Pallium. So really happy to see everyone here and look forward to learning from you guys. So thank you. Happy New Year, everyone.
I think we'll just go in order of what's showing on the screen right now. So sorry, I'm not sure of the names, but MacMill CN, if you would like to go ahead and introduce yourself.
Okay, I'm Kathy McMillan. I am a palliative care nurse in Cape Breton. And I've been involved with LEAP for a number of years and really interested in having more sessions for Nova Scotia.
Great, thank you. Dr. Kanides?
Yes, hi everyone. It's Stephanie Kanides. I'm a palliative care physician here in Halifax, and I am the medical director of the hospice that will open in April. Sharon, it's nice to actually see you. I've run a couple of sessions, and when I say I have run a couple of sessions, what I really mean is I've had incredible support in running the sessions and have participated in some LEAP programs. So looking forward to seeing how I can expand my role or do my role more efficiently and effectively.
Oh, sorry. We're going to have Robin come on over and introduce herself.
Hi, everyone. My name's Robin. I'm with Pallium Canada. I'm our marketing and communications manager. I've been around for about 3 months now, and I've just been a part of this since we've been talking with Sharon and Ashley about coordinating the webinar, and I'm just here to learn a little bit more today.
Next on our list is Watt KNIPS. That's sort of the names listed. Excuse my bad introductions.
That's okay. It's Paula Watkins, so I'm down in Yarmouth. And I have been a palliative consult nurse for the past 8 years. So I did participate as a LEAP facilitator quite a few sessions. I actually had the privilege of teaching with Stephanie just recently. And I've transitioned over to clinical nurse educator as of June. And I know upcoming in March, they have requested all of the CNEs to take the LEAP core. So that's exciting. And yeah, so I'm happy to continue spreading some knowledge, and happy to learn from everybody too.
Thank you so much. Karen Curry, if you wouldn't mind going ahead.
Hi, I'm Karen. I work with VON, Victorian Order of Nurses, and I'm a clinical educator and consultant. And hi, Stephanie and Paula. And I've worked closely with NSHA and the previous palliative manager, Beth, to support the home care nurses getting LEAP. And we've had a couple of sessions with LEAP, and I'm currently working with Sharon to expand that. And so I'm it as the, I have a invisible admin support. So I want to learn, have some more background to support facilitators who will be doing the LEAP sessions for VON. So I have that understanding and can jump in and help and make it smooth transition for folks to get registered and get the details they need to take part in the course, make it easy. So that's what my goals for jumping on for this today.
Lydia, if you could talk, are you able to connect?
Can you hear me? Hello?
Yes, we can.
Oh, okay, good. Hi. I could only get the phone to work, so I hope that's all right. Do you just want, I'm sorry I was a little late. Do you just want me to introduce myself, or?
Yes, if you could just introduce yourself, explain a little bit about like your role and where you're from.
Okay, thank you. Yes, my name is Lydia Brake. I work for South Shore Area Palliative Care, and I'm the office assistant there, so yeah.
Thank you so much. Next, if we can have Louisa.
Do you mean Louis S.A.?
Sorry, yes.
Hi, I'm Serena, but that's a much cooler name. Stop laughing, Kathy. My name is Serena, and I've just come on board as with the Health Authority, actually, as a grief, bereavement, and wellness coordinator for the Northern Health Zone. So I've been a LEAP instructor for many, many years, but this is a new role to me, and I will be working a lot with my great teams here in Cumberland, Pictou, Colchester, East Hants.
Ashley, I can see you there. If you don't mind also doing your introduction.
Sure. Hi, everyone. I'm Ashley Tynes, working in the Central Zone here with Sharon, and I'm her admin.
Great. We'll spell this one out again, trying to reduce the amount of errors. There's someone in as THORSECL.
Hi, that's it's actually Carrie Thorson. Sorry, I'm at home quite sick today, so if you don't mind, I'm going to leave my video off, but I'll do it for today. I'm the executive assistant to Beth Snyder, who's the director for IPPL of the Western Zone. So this is my first LEAP conference, so I'm looking forward to learning a lot today as to what the expectations are for me.
Great, thank you so much. I'm going to try and make sure I've caught everyone. Jeff Campbell, if you would like to join now.
Hi guys, Jeff Campbell with Pallium. I'm the Director of Business Development. I know some of you from previous conversations, but I'm looking forward to this discussion.
Okay, I'm just going to go through one more time and try and make sure that I haven't missed anyone.
I'm sorry, you missed me. Can you hear me?
Oh, I'm so sorry.
That's all right. It's Brenda Dunphy. I work for the Central Zone in Halifax for the Interprofessional Practice and Learning. And I work for the clinical nurse educators, professional practice care coordinators, and the professional practice leaders. And this is my first time dealing with the Pallium with this program.
And I think maybe one other person we missed is Landry D, or Landryd. Okay, so I think if everyone has had a bit of an opportunity, I don't know if Ashley and Sharon, you had anything else you wanted to mention. I would like to give you that time now if you have a few other pieces that you would like to go over.
This is Sharon. No, I don't have really anything else. I think everyone knows Ashley and I are the LEAP support from the Central Zone. So we, along with Pallium, have organized this webinar. So I think we should get to the meat and potatoes of it, ladies. So thank you everyone for coming. We're really excited.
All right, thank you so much. So I have the quick agenda here, which has been up for a while, so I'm sure you've had the opportunity to look through it. I have a wonderful photo back of when I still had hair. And just as a bit of an information piece, I do have my notes a little bit sort of lower down in front of me, and I also have a screen sort of up to my right, which is probably why you see me glancing over a little bit, and that's just because I'm trying to make sure what I'm supposed to be showing you is what you guys actually see. So do forgive me if I am glancing over and looking a little cross-eyed at times. I'm just trying to make sure that you're seeing what I'm seeing. In terms of housekeeping, you have already all pretty much taken up the initiative of muting yourself just because usually there's a bit of feedback. I really, really want to hear questions from you. So if you have any questions, please, what I tried to do is divide it into basically 3 major sections. So at those points, we'll open it up to questions. So feel free to unmute yourself and go ahead and ask me the questions directly. Or if you have any conversation pieces, any sort of queries, I will try to be, we'll try and make sure that we save the time so that you guys can go ahead and ask all of those questions. In terms of the scope of the webinar, we are looking at pretty much just doing an introduction to Pallium Central and really looking at it from the viewpoint of what Pallium calls coordinators. And so the idea of this is basically the people who are organizing, doing the logistics of running the session and having it set up. Please don't hesitate to keep contacting us if you have more questions, if there's anything else that we can help you with. The idea is just that this is an introduction and that if you have further details, it's not that we will never talk to you about any of these topics again. We just wanted to get sort of the base across, and then from there we're always happy to build and like develop a few more skills if we do see the need for another webinar or something like that. And otherwise you can follow up with us individually if your questions are more specific. The other thing I did want to mention is Robin, who did introduce herself earlier, is going to be monitoring the chat. So if you sort of have a question and you want to note it down right then and there, please go ahead and type it into the chat. You can send it directly to Robin or just type it in the conversation piece over there. And for you, the chat should be sort of at the bottom. There should be a little option to click on the chat. So feel free to just enter your questions there if you are the type that sort of loses track of the questions you have, and so that we can make sure that all of your questions are answered, and Robin will sort of pose those questions to me if no one else sort of asks me in person. And then I just may also be getting everyone to give me a little bit of a thumbs up at different times because you are muted. So hopefully that will be sort of a quick and easy way to make sure that, you know, speed and all of those little pieces are at an appropriate tone for everyone. Sound good? Little thumbs up. Okay, So the main objectives of this presentation is to be able to navigate Pallium Central to, sorry, I'm realizing that you cannot see all of this. Oh. Just move it. To be able to know where to access the resource documents, as well as where to add participant information. Sorry, I'm trying to make sure that it's not taking up as much space on your screen.
We can see it. Perfect.
Oh, okay. So, yes, so be able to know where some of the key resources and key documents are in Pallium Central, how to create a new course, and to know where all the content all the content pieces you would need to know before you create a course. A clearer understanding of open, reserved, and sponsored seats, as well as an insight into what the participant dashboard looks like. So the explanation is, as coordinators, you have augmented privileges in Pallium Central. So I do want to take you through, we also have quite a few facilitators attending, which is great. You have different privileges in our system than what a participant would view, so anyone who would be sort of attending a course or registering for the first time. So I do want to also take you through what their page looks like a little bit towards the end. So we are going to get started immediately with the coordinator dashboard. Okay. So this page is what your pages should look like for the vast majority of you, or will eventually look like. I know we have a few people who are a little bit newer. Once we give you coordinator privileges in our system, and if you don't have them yet, just contact us and we'll be happy to set you up. Facilitators, you all already have basically the same permissions. So as you can see, this account is anonymous TD47T. We're recording this, and for confidentiality purposes, I wasn't going to use anybody's sort of real accounts. So as you'll see, normally that would be your name at the very top. And this is the first page you come to. So on this page, one of the key places I like to just quickly mention is that you have a coordinator resources tab. And over here, we just have a few documents that are some key resources for you. And we're hoping to keep adding to this page. So do take some time to glance through this. It has just a few resources that most coordinators really like and are usually quite helpful for setting up the sessions and organizing the sessions. So that's the coordinator page. To go back to your dashboard at any time, you can just click on the blue Pallium Central in the top left corner. The other thing I do like to highlight is this kits section. So the kits are our facilitator content. So this is more linked to when the actual, when you're sort of helping the actual logistics of day of. It is just always great to have backed up on a laptop somewhere all of the presentations. So depending on which computer you have, if you have a Mac or a Windows, you download the appropriate kit for the course. And then, most facilitators do have their own materials and they usually are ready to present. But if you quickly want to just double check that the videos are working or anything like that, you have access to all of that in the kits. And so in the kits, once you download them, they have all of the different PowerPoints. And so you can quickly do a run through, make sure your speakers are working, make sure the audio is working, sort of all of those day of logistics. And just in case, the internet is spotty, you already have it downloaded. So you can always have it ready to go. The last thing I did want to quickly highlight is in coordinator reports, the one that I do like to emphasize is this one that's called the facilitator list. As you start to run more sessions, you may find that it's a little bit tricky to find as many of the facilitators. Usually the great thing is that most of our facilitators usually facilitate for multiple courses. So they usually are working with other facilitators and usually can easily reference who else is in the area, but you can quickly narrow down by province. And then my recommendation after you narrow down by province is you immediately switch this to like 50 entries, and you can quickly scroll down and up the list. The other quick way is you can start by like typing in parts of people's names, and you can like it will immediately filter for them, or by city. So, you know, if you're trying to see who else is sort of closest to you, to be able to ask, you can find it all here, and it has all of their email addresses, so you can quickly contact them and sort of ask, you know, are they available to run any of the courses that you're trying to plan for any of the dates that, or like ask them their availability. From this page, I did want to take you to sort of my sessions. I'm going sort of the faster way, which is by clicking my sessions in the top menu bar. But also optional would be for you to, from your dashboard, there's also a link that says my sessions. On this page, you will see basically any of the sessions you're coordinating or you are listed as either a facilitator or coordinator in. So for the purposes of this workshop, I have created a past session.
We have a question. May I ask it?
Yes.
One of our participants is asking if a facilitator list can be seen alphabetically, or is it just listed by ID number?
You can, sorry, the question was, can the facilitator list be seen alphabetically? And yes, it can. So again, I will just show you quickly how you can do that. Basically, what will happen is it's very faint, but there are arrows in this corner, and the minute you click on the arrow, it starts sorting it by alphabetically. So you can sort it alphabetically by the full name, or if you wanted, you could do alphabetically by city. So just a moment, or you know, reverse alphabet. So you can always sort it alphabetically that way. Okay, so taking you back to the My Sessions page for the purpose of this course, I did create a session. So there's a couple things I want you to orient you to on this page. Very quickly, I'll be going through seats at a later date, but in this section right here, you can quickly see that I created 4 open seats, 10 reserved seats, and 11 sponsored seats. And then you can see that there's 8 out of 10. So I've got 8 of my participants registered in my reserve seats, and I can see that 6 out of the 11 available seats, I have like 6 registrants who registered in the sponsored seats. So if you ever want just a really quick snapshot of how many people are registered, you can always just quickly check there. It shows the first of your 2 multiple dates if you do have multiple dates, and LEAP Core is a 2-day course, so it will have multiple dates, and it shows the start time, city, etc.
Another question?
Robin's telling me we have another question. Yes.
One of our participants is wondering what browser you are using. She is just saying that sometimes she has a hard time in the browser that she uses to see the attendance list. She has to click 1, 2, or 3 times on buttons to make it work.
I'm currently in Chrome. I do know that Internet Explorer is the one that usually struggles with our system the most. Sometimes for Internet Explorer, the easiest way to sometimes click on links that aren't being cooperative is to, when you right click and how it shows you sort of open link in a new tab or a new window, that's usually the best way to sort of shortcut that issue of clicking multiple times. But generally, we've like our system's been tested in Safari and Firefox and sort of all the other quite popular browsers, so it should be working in all of them. but I do know it does struggle the most with Internet Explorer, and usually if you do that right click and choose either open in a new tab or open in a new window, that's usually the best way to solve that. So that's the quick snapshot of what you can see in terms of the sessions. The page I really do want to emphasize is this attendees page. There are quite a few great features on this page that are very, very useful. So I will make okay. So as you go down, you should see, sorry, I'm actually going to get rid of this left-hand menu so that you can see more of the page. So starting all the way from the left-hand side, you can see that you have the heading pre-post CTC. Pre stands for the pre-course activities, so that stands for the coursework that you're supposed to do before the session date. Post stands for the post-course activities, so these are ideally the activities that your participants are completing within a week or so of the session. And the CTC is standing for the 4-month commitment to change exercise. So the reason the CTC is marked completely separately is because it is dependent on the initial commitment to change. That's one of the activities in post-course work being completed. Once a participant completes the initial commitment to change, that's the activity that starts a clock counting down, and that counts down the 4 months until the 4-month commitment to change activity is accessible to them. Yes, they do receive an automated email reminding them to log back in. However, if they never complete the initial commitment to change, it will not start that countdown timer for the 4-month commitment to change. So it is dependent on them completing their post-course activities. So that's the first 3. First name, last name, and as you can see, again, we have a whole bunch of anonymous users, but I'm sure you can envision in your mind wonderful lists of real names. It gives you the role. I did want to highlight the role because there is one activity, and that is the knowledge quiz that isn't mandatory for everybody. And the knowledge quiz is mandatory for nurses, physicians, and pharmacists. But for all other professionals, it's not as mandatory because our courses are all accredited by the College of Family Physicians or the Royal College. So there are certain questions that are just outside the scope of practice of various professions, but the other 2 activities would be mandatory. Everyone would still get their certificate. But if you're ever wondering why maybe like a social worker will have only done 2 of the 3 pre-course activities, it is because the last activity, which is the knowledge quiz, is sort of outside of the scope of practice. Some of the questions are specifically outside the scope of their practice. And so it's nice to sort of have their role listed there because you can quickly cross-reference that. If you are sort of sending reminders, please make sure you finish your pre-course activities, you can quickly check it there. It has everyone's email listed, and then attendance, hours, sort of comments, and then coursework. So for example, with our sort of anonymous user here, we can quickly go check the coursework that they've done, and you can see that they've done their pre-course activities. There should be all these nice little check marks on the side. However, if you scroll down, you can see that they haven't yet completed their post-course activities. This session has already occurred because it was on January 15th, 2018. Now, you would not take attendance a year later. Ideally, you're taking attendance again sort of the week after the session occurs because it does sort of impact billing. So we do need you to take attendance, and it does affect people being able to receive their certificate at the end. And basically, it will be grayed out before the session, but after the session date, you can go and you can fill out the attendance. And so you have these 3 options. fully attended, partially attended, and no-show. So you would select, whatever it is. And if partially attended is used most often for LEAP core and LEAP long-term care. As all of you work in healthcare, I'm sure you are very aware that emergencies often pop up and people often get pulled into different shifts, et cetera, et cetera. So this is most often used for LEAP core and LEAP long-term care because they are 2-day courses. And if, someone is unable to attend one of the days or something like that, this is where we can acknowledge that piece. So you would, for example, because it's 2 sort of 7-hour days, you just put 7 hours if they were only able to do the first one, and then you can write a little note like emergency and sort of go from there. You would, again, do something similar if someone didn't attend. You could do that. You'd go all the way down, filling out the attendance for everyone. And then the really key thing is make sure you actually save the attendance. Unfortunately, all your hard work would disappear if you didn't save it. So that's just a little quick note about taking attendance. So it would look like this. And then all the way at the bottom, I do really want to highlight the print attendance sheet. This basically, when you click on it, downloads an Excel document that would list all of, and I believe you just saw that little download arrow go at the bottom. It downloads a list that's in Excel, and it basically lists everyone's name, so it's easy for you to just print out and use as an attendance sheet. I will actually open it. Give me one moment. So this is what it looks like. And the reason I did want to highlight is because what we've done is we've also made it so that on a second tab, you have everyone's email addresses. So when you want to send an email to the whole class, you can quickly copy it from here and just blind copy the whole group to, follow up with anything they may need to know, or, tell them that, the parking costs are $10 or whatever it may be. This is an easy way to quickly go grab all of that information. Okay. Sorry. Okay, hopefully it won't do that anymore. I apologize for that noise. Okay, so the add remove attendees is strictly for sponsored seats. And again, I will get into sort of the difference in the seating at a later point in this presentation, but basically, if someone has an account, you can move them around if they're in sponsored seats. So as long as they have an account in a system, you can always add them into your course. And the reason it's limited to sponsored seats is because sponsored seats don't, the individual participant isn't paying through our system. We invoice the organization at a later date, so you can move them in and out of courses without that having financial implications, while for all the other types of seats, they will have financial implications. So, and that, like adding and removing attendees doesn't function well because, we need to issue refunds and that kind of thing if we're moving people around in any other type of seat other than sponsored seats. Okay, so those are the key pieces I wanted to go over from the coordinator dashboard. The objective we were aiming for was to navigate Pallium Central from the coordinator viewpoint and be able to know where to find key resource documents, as well as be able to view participant information. So at this point, we are ready for even more of your questions. So please do unmute yourself if you do have a question to ask. And I'm going to get Robin to go through the chat one more time to also see if someone else had typed any questions.
Hi, it's Kathy in Cape Breton.
Hi.
So in the past, we've had various participants that were having trouble getting into the exam, to the pre-test stuff or the pre-course stuff. And of course they're calling me. So I've been just sending them through to back into Pallium Canada. Is that how we do it, that they just contact you by email and say, their problems?
So yes, 2 ways. I will be going over a little bit of the participant dashboard at the end of the presentation. That's sort of my last topic. And that will hopefully help with the very, very basic issues. If it's just about, sometimes people get caught, they will register for an account in Pallium Central, but they don't actually register in the session. So for little things like that, we would be able to sort of augment your skills so that you're a little bit more aware of what their pages look like and what it should look like. However, one of the things I'm so excited to have is that we have extended our service hours. So we are working Monday to Friday from 9 a.m. to 8 p.m. and on Saturdays from 10 to 2, and this is all Eastern Standard Time, so please adjust time zones for yourself. And there are multiple ways you can reach us. One of them is the chat feature, which is really quite convenient. It's a little pop-up in the bottom corner anywhere on Pallium Central, so feel free to tell users, they're online, start a chat with them if they can't see something. And then also I'll make sure we'll have all our numbers listed again at the end, but they're sort of on our contact us page. They're in multiple locations. There's also our sort of general phone line that is going to be answered during those times. And it's going to be sort of at the end of the presentation. So those are 2 really good ways, as well as the support@pallium.ca email address. That's the one that's being monitored all the way until 8 p.m. on all the weekdays and on Saturdays from 10 to 2. Does that help clarify?
Yes, thank you.
No, don't unmute yourself. Just ask it loudly.
One of the questions on the chat is if a participant has completed a LEAP course in the past and tries to register, can they register again in the system?
Yes. So there shouldn't be any problems with them registering in multiple sessions. The only thing that does change depends on the LEAP course type. So by type, I mean if it's a LEAP Mini, LEAP Long-Term Care, LEAP Core, LEAP Paramedic, et cetera, et cetera, et cetera. What will happen is it will look completely normal to them and they'll be able to keep registering in all the sessions. What happens is if they've taken a LEAP Core in the past and then take another LEAP Core course, is that it does carry over their activities. So they won't be prompted to redo their pre-course activities. It will autofill for them. It will take their sort of the last results that they did. And I mean, if they really wish to redo all of their pre-course work, we can always delete their old entries and sort of have them do them again if they really wish to. So that's always an option, but generally most people will just carry on and sort of give us the feedback that they feel they need to or they want to give to us. And it's not mandatory to redo them.
And I have just one comment from somebody saying that they found that Pallium gets back to you quite quickly when they use the chat feature.
Sorry. Yes, we're happy to hear that. We've expanded the support desk team to have more people on, and again, this is going to get into our busiest season. So February and March are the busiest times of the year, but we are a bigger team and we're doing our very best to make sure that we do get very, very timely responses back to anyone who has questions for us. Okay, we are trucking along and we're making good time. If there are no more questions, I will move on to the next topic. I'm just looking at Robin a little, and okay. So the next topic is adding a new course. So these are the items that you should know at the time that you go into Pallium Central to add a course. So you should have confirmed who your facilitators are and sort of have discussed with them the dates, that kind of thing. You should make sure your agreement or your memorandum of understanding with Pallium is current. For Nova Scotia, I believe we're signing a provincial agreement with you, so I don't think this will be too much of a concern at these sort of individual levels, because there will be probably another, we've had one in the past, but there probably will be one signed shortly for moving forward. Your venue is booked, so you do need to have a session address, so make sure you have a location to be running the course. And if you're going to be having your participants paying fees, and I'm about to go over sort of the seating arrangements, make sure that we've clarified all of that and the sort of the local logistics around what fees you're going to be having with us. And so by us, I'm saying to send it to support@pallium.ca. So seat types. For Pallium Central, there are 3 different ways participants can register: open seats, reserved seats, and sponsored seats. Now, for both open and reserved seats, that price can be fully customized, and for both of them, participants are prompted to pay at the time of registration. So when they log in, they will be asked, when they try and register for the course, to pay a fee. And then once they put in their credit card information and pay their fee, it will then register them in the course and they will be fully registered. For sponsored seats, participants don't pay a fee at the time of registration, and instead Pallium invoices the participant costs to whoever is listed in the billing details for the organization. The difference for reserved and sponsored seats is that we create enrollment keys for both of those categories. The enrollment keys basically are when you want to make sure that only certain people are registering in the session and making sure that the right people are getting registered, because basically unless you explicitly tell us that we can share the key with someone who's interested in taking the course, it's only going to be you / whoever else is coordinating or facilitating any sort of the people who are sending communication out. You would be the one completely controlling who has the enrollment keys, so who is allowed to register. I think this is sometimes something that's really not the clearest with people. So if you have any questions around this, I would like to sort of talk about them now. Okay, it's looking good according to Robin's thumbs up to me.
Somebody is asking, are there standard fees for type of seat for courses in any location in Nova Scotia?
I do believe that this is going to be something you're going to have to clarify at the local level. Basically, there is a standard Pallium fee per participant who registers, and that gets paid directly to Pallium. However, that doesn't include facilitator costs, that doesn't include venue, that doesn't include catering, that doesn't include advertising and printing, and sort of all of those elements. Because it doesn't include all of those, it means that depending on how funding is going to work, it may adjust to how you end up being able to charge the individual participants, right? So if you have a bigger pool of money and you are able to pay your facilitators, or if, for example, you do already have a big boardroom in your hospital that you can use for the course, then obviously that cuts down on your venue costs, right? So there's all sorts of pieces like that that are sort of more local dependent to know how those costs will be sort of customized. For example, there is also a tiered part of the pricing for physicians versus all all of the other professions, because our courses are accredited by the College of Family Physicians and the Royal College. So for example, LEAP Core, again, I'm using LEAP Core just because it's one of our most popular courses. The Pallium fee for physicians is $175. And then the non-physician price is $115. But that's the fee, and then plus tax that comes to Pallium. However, because it's not including the facilitator costs, or like the printing or the catering and all of that, maybe at the more local level, you're going to have to figure out what costs you may have to include in that per participant registration that's actually respective of what your budget is allowing for. Does that help make sense? I'm going to go with hopefully yes. Again, I'm sure maybe Ashley and Sharon may be also helpful in sort of clarifying that piece with you. And again, as we know more details, I'd be happy to share that information, go over any of that with you. Okay. So I'm going to take you through creating a new course. So we were back on Pallium Central. So again, we're in a coordinator's profile, which is ideally what your profile will look like. And again, this is a page that you see when you log in. You're going to go to My Sessions, and you're going to scroll down, and right underneath Upcoming Sessions is the Add Session button. Very, very important. This is about the only thing that we can't change after you create the session. Almost everything else I'm about to talk about, we can adjust, we can edit, we can go fix at a later point. This specific step is not changeable. So make sure that when you're choosing the course type that you're very clear and you know which one it is. How is everyone feeling? Any course sort of standing out to anyone or interest? I'm just going to go with the LEAP Mini for now.
Let's do the core.
Core?
That's Sharon.
Well, it is usually the one that's run the most. And we're going to add the session. So again, we're in as anonymous user TD47T. As yourself, you automatically will get inputted as the coordinator. For facilitators, if you are entering a session, you do automatically get put in as a coordinator as well. And then from there, what you're going to do is you're going to start at the very top and you're going to add your facilitators. I would suggest just starting with typing in their last name. Dr. Kanidis, if you don't mind, I'm just going to pull you in. If I'm spelling your name correctly. Oh. And as you can see, she sort of popped in at the bottom there, and we're just going to add her to the session. So again, you would do that with all of your facilitators. If you're having anyone sort of help present, or if you have any associates that we're building up, or if you're having any subject matter experts, we want to really recognize the work that they're doing and their contribution. So please make sure you list everyone who's facilitating or anyone who is helping with the presentation, not just one or two of your facilitators. So you would add them that way. You can do the exact same thing with the coordinators. I believe Ashley, you should be here. And this is useful because if there's multiple people who are helping organize, and if you want, someone else to be able to check who's on the attendee list or anything like that, you can also, there you are. You can also add in anyone else who is a coordinator for the session. So they will also be able to see the course, because if they're not listed in the sort of the facilitator or coordinator category, it won't show on their profiles when they log in. So it wouldn't come up in their My Courses page when they log in if you don't have them. So we are being brought back to the open, reserved, and sponsored seat section. Again, when you know which payment method you have, you will know which category to go for. I will show you what open seat registration looks like from the participant viewpoint, and that will help you understand why it's just asking for the number of seats. For this one, we are just going to do reserved and sponsored seats because I don't want real people actually registering in our fake course that we create today. So for reserved seats, let's go with 10. And our enrollment key can be NS22. Enrollment keys, it is case sensitive, it is space sensitive. So please make sure when you're entering them that you're really watching out for that. And it may also be the biggest error that participants have when they are trying to register is if they're having an issue with the enrollment key, really make sure they've copied it like word for word or letter for letter, because if it's not, you know, the correct case, and if it's not the correct spelling, or if there's any additional spaces, it won't work. There is no mandatory like minimum amount of characters or anything like that. My only recommendation is make sure if you're using zeros or O's that it can't be, that it's very obvious which of the two it is, because that's usually the thing that confuses people the most. So if you're using a zero, like if it's in 2019, it's pretty obvious it's not an O, but if you're just doing like 0, 0, people wouldn't necessarily know if it's 2 zeros or 2 O's or 2 capital O's, you know, like that's sometimes hard. Sponsored seats, again, we'll just do 10 and we can come up with an enrollment key that can be whatever you like. Feel free to be as creative as you want with the enrollment keys. I do have a coordinator who was using every sort of imaginary creature possible. So I had some dragons and some unicorns being used. So feel free to be as creative as you wish. They do need to be unique. Anyone who has been like organizing sessions for a long time would be aware that we used to have multiple enrollment keys per category. We were able to reduce this to 1 because now what our system does is that it pulls that individual's person's role information from their profile. So when they create an account, they have to choose their role, so like their profession, and it will pull that information from their profile, not from so you don't need to enter multiple enrollment keys if you do have any questions around that. Robin is signaling that we have another question.
One of our participants is asking if we need to set up an enrollment key with Pallium beforehand or make one up that works for just our group. And then another participant just said, they're all for your group, but you can't use the same ones over again.
Look at that, peer-to-peer learning. I don't even need to be here. Yes, so basically I do know that in the past Pallium used to create enrollment keys for people. No, you have the power, you can do this yourself, enjoy it, have a great time. They do need to be unique and they do need to be different, and so just make sure that they're unique from each other and they're like different. So, you know, even if it's NS 21 and 22, something like that, just make sure as well that people don't end up putting in the wrong one, because you don't want people registering in the wrong sessions. Our system won't let you save the session if it has been used before. So it will, at the very bottom, when we get there, you have to like save your changes for it to save. And it will refuse to save the changes if it's an enrollment key that has been used before, so it will sort of block you at that point. Are we good, Robin?
We're good.
Okay, great. So again, that's sort of this piece. Session dates. You will say, yes, I do know the session dates. We are going to set this up for tomorrow. Again, you will probably not be setting up a session for tomorrow. You're going to be setting it up, usually a few months in advance to give your participants time to do their pre-course activities. And most sessions, usually around 8 to 5:30 or so. They're pretty long days, and then people are always happy to end early if they can. And then as you saw, it sort of does that little pop-up when I add another day. This is a LEAP core course, so it's a 2-day course. So we're going to say it's over the next 2 days. And again, you would adjust the dates and times. And just as a little note, it's a 24-hour clock, so make sure when you're doing the times that you are aware of that. I'm doing this for LEAP Core. This is a standard way LEAP Core is done. However, talk with your facilitators if logistically for any of our courses, it doesn't make sense to you can't get the participants for 2 days, or like if, for example, you're running a LEAP Mini, which is sort of a 1 full day course, but you want to divide it into 2 evenings or something like that, talk with the facilitators. Often they're very willing to accommodate the logistics of what's feasible for your group. So please don't hesitate to talk to them, and there is no problem for us, as long as your facilitators are on board, for dividing the sessions into smaller chunks. So I know we do have a group here in Ottawa that actually divides LEAP Core into 4 days and does sort of 4 chunks of 4 hours instead of doing 2 full days. So things like that are done, and we're very happy to work with you. And again, you would just add all of the days that you have here and the times in this section. So you get brought down to this details box, and it's an empty box. What we are looking to have you do in this section, is 1, we want you to put whoever the local contact is in here. The reason is because participants can't actually see any of you or the facilitator's contact information from our system. It doesn't automatically give them any of that information. So please put whoever the local sort of contact person is in here. So for example, you would say, something like that, or just whoever the local contact is, or if you prefer to be reached by phone, put your phone number, however it is, go ahead and please include it there. This is because usually a lot of people will have questions like, what room is it in? And I don't have that information unless you specifically put it in here. So for a lot of those questions, or if they're asking, will you be printing the participant manuals? We don't know. It's something that is at the more local level decided. So please put like the appropriate contact person for that local setting, because usually their questions are so specific that we would be reaching out to you anyway. So it's a bit helpful to at least have that information there. The other things that are usually put into this field are things like parking details and catering details, that kind of thing. It's just sort of meant to be a space where you have the opportunity to put all sorts of information that is specifically relevant to your participants. As we go down, billing address, it's very important you put a billing email address in because that's how we send the invoices. So we have sponsored seats, which does mean we're going to be billed for, I think we said 10 seats, right? So I would make sure that, there's someone's email address added in here. And then, tell them to bill the organization and tell them that it was all Laura's fault that we chose 10 seats. No, I'm kidding. And then you can fill out the address, but I'm not going to waste your time with doing that logistic piece. This part, you are forced to enter an address. So I'm just going to enter our address here, and it can autofill for you. So at least it saves you a little bit of time. And then in the other details, you can also put, you know, something like that for like the rooms or any other, you know, come to the 3rd floor, that idea. And then hopefully if we filled everything out correctly, I should be able to save changes. Let's see what happens. Okay, great. So it will keep me on that session details page if there was anything that I hadn't filled out or I was missing, or if my enrollment keys were had been used before. And so now you should be able to see that the course I submitted, so you can see the first start date, you can see in reserved and sponsored, I have my 10 and 10 seats, and because the course is still pending approval, no one can register for it at this point. And then if you look at these buttons, on this right-hand side, you have these 3 buttons. Again, attendees, we did bring you to before. This edit session brings you right back to the page we were just on. So if you need to add your second facilitator, if you need to go double check your billing address and come back and put that in, this is exactly where you can go back in and edit all of those details and add any additional information you may need to put in. And then even just if you're curious, I might as well show you, this is what our course looks like. And this is, again, why I said that participants don't get access to your email address, because they'll see the session details page. And as you can see, in that details box where I said, if you have questions, please contact, it'll have that all listed here. But as you can see, it doesn't it just gives them your names. It doesn't give them any, your email addresses or any way of contacting you if they do have any questions. So those were the key things I wanted to go through in terms of how to create a new course. So we've gone over all the content you would need to, at the time you're ready to create your course, and also just how to create them. So please unmute yourself, ask me all of the questions you have, all of the queries. I'm happy to hear. Okay. I'm going to ask Robin to go through the chat and just check in to make sure that there isn't anything else typed in through the chat.
One of our participants is asking, what is the time period for approval of a course when it's pending?
It usually takes a couple business days. Usually what happens is within 1 to 2, we get back to you immediately if there's anything missing or anything we have to clarify. So usually for open and reserved, we usually always need to confirm the pricing that you want set for your session. I'm flashing a little bit in the background. But if everything else is already sort of right or like correct, like if there aren't any sort of missing details or pieces of information we need to clarify, usually it is pretty quickly to switch it to approved and you can go ahead and register your participants. We usually do send you a quick email saying your session is approved. Please let us know if you want any help with the registration instructions. Sorry, are you hearing Robin's voice loud enough when she asks the questions? Okay, good. Sorry, yes, Robin.
One other question. If you are identified as a coordinator, will you be given a different login than the one you have been using as a participant or a facilitator?
No. It's the same login, it's the same account. You will be able to sort of access everything the same ways.
And the second part to that question, how long before a course is happening can a course be set up?
We have courses like set up a whole year before. There's no, like, as long as you have the registration, I mean, I think our system is equipped to go, you know, years into the future in terms of the session date. So there isn't any sort of mandatory time frame. As soon as, like, again, most people, it's usually the opposite way where they're trying to see how tight of a time frame they can fit everything in. So the more time you have, it's awesome. Like, you know, if you are planning all the way into the fall or into next year and you already know that, you know, you want to book people's availability as early as possible because as you often will find out, most of our facilitators are full working professionals with, you know, full-time jobs. So making sure to catch them at the right times is often something that you're doing a bit of a balancing act and finding as many people as you need and making sure that they have the time and the availability. So, you know, as long as you get your facilitators and they're available those dates, there's no reason that you couldn't book, you know, however much time into the future you want. If I flip that question around and you're asking like, what's the shortest timeline? Realistically, getting the course set up in the system isn't what should be the time-consuming part. The time-consuming part is making sure you give your participants enough time to do their pre-course activities. And again, most of the time, your participants are full working professionals, busy, and have pretty long days, or you know, if you have shift workers, you know, their schedules can be all over the place. Pre-course activities shouldn't take long. They take maybe 20 to 40 minutes to do all three activities. It's not meant to be a hugely time-consuming piece, but, you know, making sure they sit down, register, and do their pre-course activities, whatever time frame you can make sure your participants get that done within is the limit for setting up a session and being able to have the session occur. Okay.
Okay, I have one question. I have two questions actually. So if I am listed as a facilitator in the course, and do I have access to go in and see everybody that's participating and what they've done as pre-course? Yes? Yes. Okay. The second part of it is, if I am only listed as facilitator and not as a coordinator, can I go in and change anything? Like, for example, that text box that gives some directions of room and stuff. Can I go in only as a facilitator and change that? Or is it only a coordinator that can change anything?
You will be able to see both that edit session details, and you can go in and edit that. And you will also be able to see the attendees button, which would take you and you'd be able to see who's registered and all of those details.
Okay.
You may want to sort of like inform us if you want to be contacted. So usually when people are requesting to register for a session and they come to us to request to enroll in the session, we normally contact just whoever's listed in that coordinator section. So if you're listed as a facilitator, we normally, unless there's a note somewhere else, we normally just contact who's in the coordinator section. So it may be worth your time to make sure you're listed in both sections if you do want to be contacted by Pallium when we're asking for like clarification about the session details and that kind of thing, because normally we only contact the coordinator. We don't normally bother or we don't often contact the facilitators, because most often they're not the ones, sending the emails to all the participants for registration. Again, we have some great facilitators who are here today, so maybe they will be a lot more involved, but usually they've passed that task on to the coordinator, and they want the person who's in the coordinator role to be doing most of the follow-up. So we usually, who we're going to email to request how many pocketbooks you want, that kind of thing. We normally ask whoever's listed in the coordinator section. So it may be worth following up with us, or like adding a note in the details field that you also want to be contacted. So we make sure to reach out to you as well if you want to be the person also contacted for any of those kinds of queries. Okay, I need to work some movie magic, I guess, for a couple of minutes to make sure that we can now register people in that sort of our session that we just created. So I was going to give you a little break, if that is okay with everyone, and give you a few minutes to go stretch a little, maybe grab a snack, grab a coffee, before we move on to the participant dashboard. Robin is signaling that we have a question, but how about I take that question when we come back from our break? It is 10:45 my time. I'm not sure what it is in your time, but sorry, 11:45? Yeah. So if we can come back in 5 minutes, if that's okay with everybody, then we will just start back up for 11:50 your time, 10:50 my time. Sound good? Okay. I hopefully everyone is regathering again, and we have most of our participants still here. We haven't lost too many of you, I hope, now that you had a chance to escape. Okay, so I do believe we had one last question before I move on to the new topic.
Yes, one of our participants would like to know what the ideal amount of time to set up is, so that the pocketbooks get sent to them in time, taking into consideration timelines, etc.
I think, in my opinion, ideal is about 3 months out from the course. Realistically, you usually are trying to give your potential facilitators the most notice you can, to make sure you get the facilitators you want for the dates that you would like. And for us, in terms of our system, I know I mentioned several other items that you sort of need to know by the time you're setting it up, but the minute you have your venue and you have your facilitators, those are the really key things to make sure we're able to set up the session in the system. So basically, as soon as you know that, let's get it set up and let's have it running, and we'll make sure that people have their chance to register. Also, there may be a little bit of variability in terms of how much advertising you do. Again, I'm not sure specifically to all of the various local contexts, but a lot of our sessions, when you are not just organizing in your own in your own facility, and if you're working with a few other local partners. So most times, ideally when you're running a session, you're trying to also have a few other sort of either hospitals or care homes or any other settings that you may be connected with, and also potentially opening up your session to have some of them attend. Again, when you start involving more people and more groups, usually that may also mean that you need to sort of send them the advertising and the saving of the dates, and let them know further in advance so that they can help you recruit from amongst their staff to then find participants. So again, that usually takes a couple months, because if people are needing to move their shifts or ask for leave, you can also, it may also depend on the hospital, because I know I have talked to some organizations where everyone's shifts are set full 3 months in advance. There's no sort of wiggle room that's shorter than that. So again, depending on your local setting, what is realistic for your staff? Who are you having attend, and what works for them? because if it's 4 or 5 months in advance that you really need to be planning to make it so that you can have the ideal turnout you want for your session, then maybe that's what works best. But a lot of times, if you know people are going to need to move their shifts around, or they're going to need to find coverage, it then sort of adds the more advanced notice that you can give them, the more helpful it is for them to be able to actually register and move forward. I know that's a half answer both ways, but I think you can understand why I'm saying, like, look at your audience, look at who's going to be participating, and respond to their needs. Another question. Yay! This is exciting. Okay.
One of our participants is saying it usually takes 2 to 3 months for positions to be backfilled to allow certain people to attend the course.
So there you go. The whole backfill piece, and if that's what works in your setting, then you need to be telling people ideally 2 to 3 months so that they can make sure that they're backfilled. So then for us, if you have 3 to 4 months, then that's pretty perfect, because then you can be sending out your advertising. You can be helping a lot of people know further in advance. And you'll see that in our registration instructions, our suggested registration instructions, we do give them a registration deadline. That doesn't actually impact when the cutoff for them to be able to register for the course, because in reality, someone can register in the course all the way up until the session date itself. So, midnight of the session date, or the day before the session date, that's really, the last time that someone can actually register in the session. But usually the reason we give people registration deadlines is because they need to make sure that they're covered. You need to sort of have a better sense of how many participants you have for ordering books and that kind of thing. So usually having a registration deadline, usually 2 weeks out from when that course is going to happen, that's usually something that is a little helpful tip, because then it pushes your participants to make sure that they're actually registered because they think there's a deadline. And then it helps you, because then if you get a high volume of interest, but then when you send the instructions out, no one's registering, you more easily know whether they're actually going to come, or whether they were just, ideally they would have liked to come, but in the end, sort of whatever barrier they may have had came up. And then it also lets them register with enough time that they will be able to do their pre-course activities, and they don't feel sort of stressed about it. They know, okay, let me make sure I set aside, a half hour, an hour on my weekend to make sure that I get those pre-course activities done. And usually, within 2 weeks, most people are able to find a little time slot to do their pre-course activities. Robin is just checking the last of the questions for me, and it doesn't look like we have any other questions. So I'm now going to go to the participant dashboard, which anyone who's a little bit newer, this is what your page probably does look like when you log into Pallium Central. Contact us, support@pallium.ca. And just let us know, hi, I'm going to need coordinator privileges in the system. Please let me know, what my next steps are, and we will sort of set you up for that. If your page does look like the participant page, we want to give you the correct permission so you can do all of these fun things in our system. Okay, so this is our participant dashboard. And as you can see, it's a very exciting page. And we are, again, anonymous user VK5M. So from this page, this is what people see once they create their account. So they would go to our website, they create an account, they get the confirmation email, they click on that link, they log in, it will bring them to this page. On this page, you'll have a couple different ways that they get enrolled in the course. If you have open seats, they're going to come to this My Courses page, and they're going to go search for the course. So, oh, sorry, not the My Courses page. That's what they actually have registered in. If you have open seats, they're going to come to the Find a Course page, which will hopefully in a minute. Why is my page not loading? Okay, I'll figure that out in just a moment. Okay, let me just try in one other place. I'm not sure why it is not cooperating with me right now. It's completely frozen. Oh, okay. It just took a little long to load. My apologies. Okay, so if you have open seats for your session, this is what's going to happen. So as you scroll down the page, you'll see that it lists like all of the courses happening all over the country, and you will see that this is the difference. So these ones that don't have this enroll button is because they are courses that only have either reserved or sponsored seating only. Any of the ones that have an enroll button, if you see, I'll just click on it and it will give me the option as it loads very slowly. It gives me more details about the session, and it tells me my pricing with tax, and I can proceed with payment. And you just put in your credit card information and it will register you in the course. So again, this is how participants, when they have, when they're looking to register in open seats, would find the course. And as I slowly wait for our wonderful page to load, you can also note that at the top you could filter the search. So you can just say, filter by province, and then they would be able to see their session dates, session times, and they would be able to enroll as appropriate for their respective sessions. So again, you can see the first start date and start time, location and province, but for example, if they needed, they could filter. I mean, I know right now there's a few open seats courses in Saskatchewan. So again, it'll probably take a moment. It's probably one of our slower pages to load because it does pull up every single session that happens all across the country. So that may be why it's acting a little slow today. So again, you would see the details, and you can see that these sessions that are currently being listed, these ones only have either reserved or sponsored seats. But over here, you can see that this one does have some open seats, and I would be able to like enroll directly. I'm going to go back to the dashboard. So that's how participants register when you have open seats, or they're supposed to be registering in the open seats for your course. For all the reserved and all the sponsored seats, this is where they would go. You would provide them with their enrollment key, so they would click on that tab and go, do you have an enrollment key? If you remember, the enrollment key we chose for our wonderful course that's happening tomorrow was, this is the enrollment key for reserved seats. So with my wonderful movie magic, I went in and I added a price, and it adds the taxes for your province. And then again, the non-physician is being pulled up. The price for non-physician is being pulled up because this anonymous user is considered an allied health. That's their role. It would pull the price that is appropriate for their role from their profile information. And then again, you'd go to the proceed with payment, and you would put in your credit card information. It doesn't happen much anymore, but if people don't have credit cards, often their work may have a credit card that they can use and have sort of work pay, and they negotiate it with their work. They can, they don't necessarily have to be the user. The credit card doesn't have to be in their name for them to be able to use it. So they can ask, maybe one of their family members to pay using their credit cards, or lastly, if they really don't have one, they can always contact us, and we can always work with them to figure out what other form of payment will work for them. So we're going to go back, and now this time we're going to go in and we're going to use the enrollment key, which was our sponsored seat enrollment key, because I'm not paying for an imaginary course right now. Anyways, so we're going to enter that enrollment key that we created just for that session that we created a couple minutes ago. And now you can see that I am registered. So it brings them directly to their My Courses page. And you can see that this anonymous user was previously took a LEAP mini course. So you can see their past activity. And for users, we have these nice little bubbles that are meant to help them understand that they are, how much of their pre-course activities they have done. And I will pause right now because Robin is mentioning that there are a couple of questions.
One of our participants is asking, we have 3 participants who paid to take the course in the fall, but had not taken the correct steps to enroll, and unfortunately we did not have spots. When they go in to enroll for our next course, what steps would they take? It was paid by their place of employment.
Well, I would say probably we can follow up about this conversation sort of outside of the webinar. What I basically need to figure out is whether we refunded their payment or not. If they, and if you're holding the money or if we're holding the money, but basically if we did refund them, then they would register like anyone else is registering for their course, because we did give them their money back, so then they would need to re-register. If we're still holding their money, or then we would register them as sponsored seats, or sorry, as probably either reserved. We'd help them register depending on who's holding the money appropriately. So if the hosting organization still has the money, we would post them as sponsored. If Pallium Canada has their money, like they never asked for the refund, then we would put them in as reserve seats, so that and we would know that the payment has already occurred. Just send us an email with more details, give us their full names, and we'll make sure we follow up appropriately for all 3 of those participants. Okay. All right. Was there another question that sort of come in? Okay. So anonymous user, you can see, took a course way back in 2015, took Leap Mini, had a great time, never did post-course work, shame on anonymous user. VK, we need you to do your post-course work. But outside of that, you can see also the reason I was using this profile is because I wanted you to see the difference of what it looks like to have a past course versus an upcoming course. So as you can see, you have these, as a participant, you have these two other options. If for any reason, before the session date, they know that they can't attend, so they have the option of canceling the registration. When they do this, it will confirm that they want to cancel, and it will refund them their money if they have paid any money. If it's a sponsored seat, then they never paid, so there is no money to refund. Details, again, if you remember that page and why I was mentioning the email addresses, you can see that only the additional information I input is how a user would have any contact information for who to reach out to if they had any questions. And it has sort of all of the session details and a list who's organizing and who should be their facilitators. I will pause because it sounds like we have another question.
Is there a cutoff date for canceling?
No, currently there isn't. Basically, we really recognize that stuff comes up in people's lives, and especially in healthcare, people sometimes don't have as much control over their work schedule as would be ideal. So we do really respect and recognize that for them too. We just ask that they cancel by the day before, because then it allows them to do that. As you can see, the minute it's sorry, you wouldn't know this, but basically as of the session date itself, they no longer have that ability. You can follow up directly with us. Again, if there's extenuating circumstances, we are happy to accommodate, but realistically, for most people, if they know they're not going to be able to attend, they usually do know that at least by the night before, so they are able to go in and cancel their registration. If they did know further in advance, but they're having a bit of difficulty logging in or anything like that, just make sure you send us an email, send us a note, get us on the chat, give us a phone call, any of the ways, and we'll make sure to follow up about their accounts and make sure that they get their money back. If it's a sponsored seat, it's not as important that they cancel immediately, because we don't invoice for no-shows. But what it does do that's a little bit annoying is for you as a coordinator who's trying to plan, if if 4 people are taking up spots in your course who aren't going to be able to attend, then that's a bit annoying for you if you're already at the maximum number and you're trying to get 4 new people in, because our courses do cap you, right? So if you have 10 sponsored seats and you have 10 people registered in the sponsored seats, you can't have more people register for sponsored seats if there's no more seats available. It does stop at that cap. So for sponsored seats, you would want people to make sure that they cancel the registration, or you can go in and remove them from your session, because to open up those spaces for people who will be actually able to attend. Make sense? Okay. The other element I did want you aware of is there's 2 ways to go to the coursework activities. You can actually click on Leap Core itself right there, or you can click on the coursework, and what it will do, it will bring them to all of their activities. So you will notice that the launch buttons are a little grayed out. The reason is that they you're supposed to do attitudes first, and then you can go down the row for completing the activities. And then the due date is set as tomorrow because that's the first date of the session. As a coordinator, when you go in and you look at this page in your profile, you're not going to usually have any due dates, but you will be able to see all of these. As a coordinator, you'll also notice that none of these are grayed out for you, because you're a coordinator and you have augmented privileges, so you are able to see a lot more than a participant would. The other thing I do want to highlight is that this is where you can come to grab the participant manual. So again, discuss it with your facilitators and you know your participants the best. As you can see, all of the participants will have access to the participant manuals with their online accounts. If you have a tech comfortable group who are willing to bring in their laptops and their iPads and all sorts of devices like that, then you are, again, very welcome to let them do that, and you don't necessarily maybe need to print as many of the participant manuals. If you do that, please talk with the facilitators, because there are some handouts and some activities that they will want printed out and done on paper, but otherwise this is where you can access it. If you do need to print it, if you just hit the launch button, it basically opens the PDF that has the participant manual, and you can download it and get it printed, put it on a USB, sort of share it, whatever you prefer. So they do have access to it here, and each time, basically as a participant, I click on the launch button, it will take me to all of the questions. I finish all my pre-course activities, I'm done. And then after the session date, all of these launch buttons will be enabled. I will be able to do all the post-course activities, but they only are allowed to do them after the course occurs. So that's the participant view. I'm just double checking my notes to make sure I have gone over everything I want to highlight on the participant dashboard. Oh, and then I know someone did ask me earlier, so you see this chat icon in the bottom corner. Again, if anyone's ever experiencing any difficulty, you can just click on here, you put in your information, and it connects you right to us here at Pallium. If for any reason, or if it's after hours and there isn't someone there, it does end up being logged as basically an email query. So no matter what, if they do want to contact us this way, you can always, they will always get a response. Usually if you start the chat now, during business hours, there will be someone on the support desk team who does respond live to you. And if it is after business hours, it'll just get sort of logged as an email, and we'll follow up with you by email in return. Okay, Robin did signal that we have another question, so.
We have one comment and one question. Just doing a time check, we do need to end in 13 minutes.
Okay.
And then another question from a participant. If we have a wait list, can we request that participants confirm 1 week prior?
I do it, whatever works best for you in terms of the waitlist piece. So usually you end up having to do a couple follow-up emails, sort of correspondence pieces with participants anyways, because you're usually trying to follow up with the last handful who haven't done pre-course activities or something like that. So in those emails, you can also ask for a confirmation. There's no reason that you can't customize it to what works best for you. Yeah, there's no reason that you wouldn't be able to do or ask for confirmations. You have access to their emails, and you can just say, please make sure you confirm by X amount of time.
Another one?
Yes.
One of our participants is asking, do the session fees include the Pallium pocketbook for all participants, including CCA?
It depends on the course type. So most of our courses, the pocketbook is included in the participant fees. The exceptions are lead paramedic. They get the Pallium app instead of the pocketbook, so none of them get any pocketbooks. We found that if you're running lead paramedic sessions, often the feedback we get is that they don't need a copy per paramedic. What they do instead is usually for lead paramedic courses, they will have a few copies that are resource copies at the base and maybe like a few per ambulance, however they want to sort of set it up at the local level. The other course that there is an exception in terms of books, and I think this is where the comment is coming from, is in LEAP long-term care. In LEAP long-term care, we have a category which in Ontario we often refer to as personal support workers, but that's an Ontario term, and I believe that's what CCA's care aides or some version of care aides. So care aides do not get a pocketbook. The feedback was that, any way we could sort of support having a little bit of a lower fee, and in terms of the resource that is the Pallium pocketbook, it wasn't as useful for them. So in LEAP long-term care, that's the only other category that doesn't get the Pallium pocketbook. Those are the main courses that don't get books.
Part of this is really a comment, but just to another participant's question about the wait list. So Lydia is saying we usually have a wait list and we usually ask people to register by X date a couple of weeks prior. And then after that date, we go to the wait list if there are spots left unconfirmed. This has worked out okay for our program.
I think that's great. I know we're hoping to do more and more things that will sort of enable coordinators to share tips and tricks with each other, and that's something that's in the works. So hopefully by sort of the end of this year, we might have a little bit more spaces that would allow for some great tips like Lydia's suggesting about what you can do with your wait list and how to make it so that you really, all the spots, especially when there are groups that have wait lists, do get filled. Okay, so I am going to bring us back to our presentation. So the point of this topic was to look at the participant dashboard and have at least a little bit more insight of what it looks like from their viewpoint, as well as how to support registration, and at least a few of the basics of, if a lot of your participants are coming to you, because most often they will come to you first because you are their face, you are sort of the person that they're more familiar with. What might be a couple of the quick things that we can troubleshoot for them. Please don't hesitate to ever send them back to us. Again, I do want to take a few moments. If you have any questions, please do unmute yourself and ask away. Okay, I'm going to just check in with Robin and make sure that nothing else is coming in through the chats.
I have one question. Somebody is asking, I usually get the question, how long does the pre-registration work take?
I would say anywhere from like 20 to 40 minutes to do those pre-course activities, and that's for all of them, if that's what they're meaning by registering and doing the pre-course work. In terms of the activities, so there's an attitude scale, a comfort scale, and a knowledge quiz. So again, depending on the profession, so like for example, we were just mentioning CCAs, the knowledge quiz would be beyond the scope of practice for most CCAs. So that's an example of someone who wouldn't need to do the knowledge quiz, but they would still be asked to do the attitudes and comfort scale. And again, there's nothing against someone doing the knowledge quiz. It's just that it does sometimes throw people off because there are, questions asking about, medication and like getting into a little bit more or of those like nitty gritty details around, titration and sort of pieces like that. So it often just throws them off a little bit, and they're and so it's just usually the they can still answer it and do it to the best of their ability. There's nothing stopping them, and we're very welcome. We welcome them to do all of the pre-course activities. The piece that I did want to mention with the comfort and attitude scale is that it's a scale. It's sort of this 1 to 5 scale, and you rate whether you're very comfortable or very uncomfortable, I think is the terminology that we use. And for the people who are decisive, that's really easy. They go, okay, 3 on this topic, 1 on this topic, 5 on this topic. For people who are really like, am I a 4 or a 4.5 or a 4.58 or something like that, and I really struggle with sort of making that sort of decision on a scale, it may just take them a little bit longer to go through the pre-course activities if they really do sort of weigh the topics for a little bit longer. The chat is lighting up, so I do imagine that there may be another question. No, okay. So again, feel free to interrupt as we wrap up a little bit. The first thing I do want to go over is, again, I was mentioning the different ways you can contact us. So again, there's a lot of resources on the materials page in Pallium Central. We did record this webinar. We're probably going to have to take a little bit of time to pull it together, edit it a little bit. However, we will make sure that that is shared and emailed to all of you. On that note, we are also looking to get some of your feedback. So in 2 different things. One, we're always happy to receive your feedback, and especially let us know if there are certain resources or certain lists or a key document that you think would make a huge difference into sort of supporting you being able to run these LEAP courses, because we really want to make this as easy as we can for you. So let us know. I did want to go over those extended hours. Again, we are doing these extended hours all the way until April 13th. That's the last Saturday of the extended hours. And then from there, it's usually more like 9 to 5. So you can always reach us. I've put the general phone line. Again, that's all answered until 8 p.m. It's the support@Pallium email address. And then you can always reach us through the chat feature. And all of those are great ways to contact us. We will be following up on the specific other way I really would like to collect your feedback is for you to fill out our survey. We really would appreciate knowing what worked well, what didn't work well, what else we can do to make this webinar better, or potentially look into future webinars. What topics do you want to hear about? Robin just posted that link, so if as you munch away on your lunch, you have a couple minutes to just give us that feedback, it is greatly appreciated. When we send a follow-up email with that link, we'll also make sure to link the survey there. I know we only have about 2 more minutes left. I did want to ask Sharon and Ashley if there was anything else that they would like to say before we wrap up completely.
Well, this is Sharon. I just wanted to say you rocked it. You did great. That's not easy. That's a long time to do a webinar all by yourself with everyone's cameras turned off. So you did a great job. I know you had a colleague there, so that helps at least, right, to have someone to talk in the room. But you did a great job.
Great appreciated.
Yeah, you have a great smile and a lovely way about you. I thought it was very practical and very hands-on. So great job. You rocked it.
Oh my goodness, I'm blushing over here.
Yeah, so that's awesome. And we will make sure, Ashley and I, that we get the link out to people, but you're emailing the people who are SVP'd as well, right?
Yes, we'll make follow up.
Yeah, that's great.
And I know there were a couple people who weren't able to attend that I don't know if you were.
That's okay. There's enough of us who have attended. So I thought this was great. So we really appreciate you. Thank you.
Oh, thank you all so much. I do just want to appreciate all of you for taking the time today to, set aside this chunk of time for me. We are pretty much ending exactly right on the dot. So the link is there. Please give us your feedback. Again, on that coordinator materials page. I know that like Robin and I have been discussing a couple other resources that we want to get up for you on that page, so please don't hesitate to let us know what other things may be useful for you. Thank you so much for your time, and I wish you all a great week.
Take care, everyone. Happy New Year.
All right. Did anyone have any last questions? I guess now that I've allowed people to go. I think everyone's sounding good. All right. Have a great time, everybody.